In this scenario, the healthcare worker undertaking aerosol-generating procedure is using a coverall, an FFP3 mask, eye protection and non-sterile gloves as personal protective equipment. Perform hand hygiene before donning on personal protective equipment. Ensure that you are bare below the elbows and wash your hands with soap and water or use an alcohol-based hand rub. Put on a coverall that is the appropriate size for you. Do not apply the hood of the coverall as there is no requirement for airborne transmission. Also, we recommend putting it on back to front as it is safer to remove afterwards. Your buddy can zip up the back of the coverall. Next, put on the FFP3 mask. Ensure this is the model of mask you have been fit tested with. Perform a fit check. Next, put on eye protection. If using the visor, ensure it fully covers your face. Lastly, put on gloves. Ensure the gloves cover the cuff of the coverall. The healthcare worker is now fully donned. When you have finished the care activity, personal protective equipment must be promptly removed. It is imperative that you protect the mucous membranes of your eyes, nose and mouth. While inside the room, remove the gloves first, as these are the most contaminated part of your personal protective equipment. Do not touch the outside of the gloves as this is contaminated. Dispose of them in the bin and then perform hand hygiene. Next, step outside into the amber zone. Close the door and perform hand hygiene. Areas where aerosol-generating procedures are taking place, such as the spinal cord injuries unit and CHDU, are recommended to have an amber zone where there is not a lobby. The amber zone is where the staff member stands to remove their coverall, FFP3 mask and eye protection. This is marked with yellow tape and has a clinical waste bin inside the zone, and hand hygiene is accessible. In the amber zone, your buddy will be needed and should be wearing aprons and gloves. Ask your buddy to unzip the coverall. Then carefully remove the coverall from top to bottom, touching only the inside. Dispose of it properly and then perform hand hygiene. Next, remove your eye protection. Do not touch the front of the visor or goggles. Dispose of it properly and then perform hand hygiene. Lastly, remove your FFP3 mask. Do not touch the front of the mask. Dispose of it properly and then perform hand hygiene.